Okay, let's talk about our patient today. Our patient today is a dentist. Young lady, a preeminent lecturer,
The dental hygienist
from Bulgaria,
Buffalo, New York,
Atlanta, Oklahoma, Vancouver, Canada, Boston, Kansas City, San Francisco, Montreal, Munich, Germany, London, and Santa Maria, California. And we're going to place 14 Lumineers,
8 Lumineers,
10 Lumineers,
6 Lumineers,
10, 2, 8, 8, 10, 10, 8, 10, 8 Lumineers today on our patient.
and now we're not treating teeth anymore. We're treating smiles.
Isn't that beautiful? So let's look at the transformation from where we started and where we are. Our patient today is an example of that. So what we're going to do today is we're going to take this beautiful young lady here who, when she was 28 years of age, finally got her teeth to look better than they were, because when she was, about 8 years old, you broke one? And until she was 28, she always had a mismatched smile. And the way they finally solved the problem was they did 4 teeth, not 1 tooth. Because you know and I know 1 tooth is tough. 4 teeth is easier. The only thing is that they didn't do it with Lumineers. They didn't do it with serenade porcelain veneers, as we called it at that time. They did it with traditional veneers. And she went through a pretty unpleasant experience. Is that right? Very unpleasant. But the dentist did a nice job. But she's still not satisfied. But what we're going to do on her 2 laterals and her 2 centrals is we're going to show you how to prepare the surface for bonding to porcelain. And we're going to bond to her cuspid and her first bicuspid. And we've already selected the shade. Now my assistant has put 2 solutions on the porcelain veneers. And one of them is a citric acid called porcelain conditioner. That's an organic acid. You can't use phosphoric acid. And the reason you can't use phosphoric acid is it won't activate your silane. And the silane is the key here, where you're going to get a chemical bond between that and the ultrabond. My staff has everything prepared before I walk in, and they'll spend an hour or so getting ready for the first patient. And I'm wearing 4-power magnification. You'll be able to see this close to the tooth visually. No human being can see that well, no matter how young they are. But physically, I'll be this far from the patient. This gives me great control when I'm working without anesthetic. You'll see me, when I polymerize her teeth, I'll do polymers. I set 8 Lumineers in less than 1 minute because I have the sapphire light. And so a couple of tips is, when you take your impression, I recommend that you have the patient wait in your reception room for half hour to an hour while you pour the model, let it set, and you personally check those gingival margins to make sure you're satisfied. What I like to recommend is that before you let your patient go home, you pour your first model and wait until it sets. And when you're satisfied with those gingival margins, send your patient home. The other thing you want to look out for is what happens when the Lumineers fit the model and don't fit the teeth. Chances are that impression was taken out too soon. So a distorted impression looks exactly the same as one that's perfect. Leave the impression in for an extra 30 to 60 seconds, more than you think you need to, and it pays big dividends. And we're going to get started with surface preparation on the teeth. And my first step is to take the micro etcher, and I don't want you to breathe now for a second, just don't breathe. And we want to remove that glazed surface. Now we'll wash that off. Okay, now we're going to put on paint on dental dam. And I'm going to put it on the lingual side of the maxillary arch, open wide. What I'm doing is putting on the same paint on dental dam that we apply for chairside bleaching. I'm using the blue shade and I'm applying it to the teeth that I don't want the Ultrabond to bond to. Remember, we haven't done any cosmetic contouring on her teeth. We just, in this case, I'd say about half the time, and give it a 3-second burst, the sapphire light. I almost always have to do some cosmetic contouring. Now, the best way to protect your eyes is to close them. So close your eyes. I place the light about ½ inch from the surface. And let's see if I got this cured to a rubbery stage. And wherever you got that blue paint on dental dam, it'll prevent the Ultrabond from bonding to that lingual surface. We need to put some acid on the porcelain, and we're going to put hydrofluoric acid, and we're going to use Porceloc. It is medium viscosity, and the advantage of this is that it is the least, I guess you'd say it's the least toxic of any hydrofluoric acid that you can apply in the mouth. Okay. So I'll leave this on for about a minute. So let's wash that off. Okay, so now we're going to apply porcelain conditioner, which is what? Citric acid. And by putting the porcelain conditioner on the porcelain, it will activate the surface to activate the serenade prime when we put it on the surface. We'll now take etch and seal, and we'll put etch and seal on the cuspid and the bicuspid. I like etch and seal because it's medium viscosity, the one I use, and it contains aluminum oxalate. I just push it around, and you use it on exposed dentin. The aluminum oxalate will seal the dentinal tubules and help prevent sensitivity. Now we'll wash these off. Now we're putting on serenade prime on these porcelain surfaces. Serenade prime is a silene, and you want to have your silenes just activated at the time that you're going to bond to that porcelain surface. Now I'm putting tenure AB on. Tenure AB is unsurpassed in clinical studies, reliability, and convenience to the dentist. Now we've done surface preparation with the porcelain. I'm going to put a Lumineer on a tooth with nothing in it. As I say, we've already selected the shade. And now we're going to put the shade on here, which is we had selected, I believe it was a combination of B0, was it, and Supreme White? B1, okay. So we're putting the tri-in paste on. Now look at the difference in shade between her left central and her right central. They're the same shade Lumineer. And so what you're getting is a reflection back of that etched surface when it gets to air between the tooth, the porcelain surface. There's no air between the Lumineer on the left side, so you get an entirely different shade. So never try these in without using the Ultrabond tri-in paste. It's very important that the patient gets involved in the shade selection. Do you like the one on the left or the one on the right better? The one on the left. Okay. So now we'll just remove these. So now by putting tenure S on, I'm removing the Ultrabond tri-in paste, and I'm applying it to all of the surfaces that we've done surface preparation. You see, once surface preparation is complete, a race begins between contamination and resin. And whatever gets there first wins the race. So now by putting tenure S on all over, I've got resin on that surface. And tenure S also has another benefit. Tenure S will cause the Ultrabond tri-in paste to polymerize. Left central. Okay. Left lateral. Just gently place these in. See a little oozing out around. Okay. Take a brush and wipe a lot of that off. And the first thing I will do is take the 2mm tip and spot cure it for 1 second. Close your eyes. 1 second spot cure in the center. I see a little ooze out before I spot cure. Good. Close your eyes. Now we'll go over to the left side and continue on. And close your eyes. What I do is I gently place it on the tooth, the Lumineer, and I see excess ultrabond all around the margins, and then I close my eyes and spot cure for 1 second. Now I have placed these so they won't slide all over. This is a cotton roll with tenure S on it. And I just, since these are spot cured in place, I can go back and wipe up some of that excess. Close your eyes. Now I'm going to give a 5-second cure to each tooth. Close your eyes. And close your eyes. And close your eyes. If I've done everything correctly, these are bonded, they're fused, I don't have to worry about moisture contamination. So now we're going to do cleanup. And since I haven't spent 3 hours in preparation to 5 hours, I've got a lot of time to spare here. All right, so I got a little bit over here, we'll take that off. Now let's take a look at the lingual side here. And we've got it all cleared off around the gingival margin. So the next step is I'm going to take a Shure 349 instrument here, and I'm going to start removing some of the ultrabond that's on the labial surface. And I take off all the stuff that's easy. And remember, I don't try to get everything done on the placement visit. Now, the Shure 349 instrument is very important that you use this and not your hygienist scaling instrument, because you will never be able to scratch glazed porcelain with the Shure 349 instrument. Now what I'm taking is the football-shaped diamond, and I'm blending porcelain, ultrabond, and tooth structure together. And this material and this tooth are all one solid mass. They have the same properties. All right, now we'll take the 12-fluted burr. All these instruments I'm using are in the clinician's finishing kit. And I'm going to remove all of the ultrabond interproximally and at the gingival margin, so that when I come back with my diamonds and I'm looking at something that's porcelain colored, I know it's porcelain and not ultrabond. And that gives me a lot more control. We will spend a little time on finishing, because if you want these to turn out right, you have to have careful attention to the interproximal embrasures and the emergence profile. So let's let our patient take a look. How do you like that? And now I'm going to remove that shoulder that's on the porcelain. So now I'm just going back and removing what I didn't remove with the 12-fluted burr. And this is where you start opening up the interproximal embrasures. Now, defining your interproximal embrasures is very important. And also I'm going to use a needle nose diamond too. When we open the contacts, one of the things that's very important is to take all the ultrabond out as much as you can from the interproximal embrasures. Because when we go to open the contact, if we run into resistance, it means there's still some ultrabond in there. And these embrasures are really critical, and getting that shoulder removed is important, so it just blends seamlessly with the tooth. And if she doesn't like this when we get finished, I can take it off, put her back to where she was, and repolish that porcelain. Okay, now I'm going to go back and test for the shoulder and make sure that it's blended. And the shoulders that I don't get done today, I finish on this follow-up appointment. And then to open these embrasures, I contour with this long diamond. Let's take a look over here, and I want to flatten that cuspid just a little bit. And I'll take a little off here. I think I still have some ultrabond on there, so give me that Sure 349 instrument. Now these embrasures begin to open up more. Open. Now gently put your teeth together and grind them around on your back teeth. That's it. Open. And let's see what we have here. Good. I'm seeing a mark on her posterior teeth. Teeth on teeth. Oh, here's a little spot here we got to look out for. Right here. Now, if you're going to have fractures after placement, it's usually because you've missed something in occlusion. You got to get those out of there. They look very innocuous, but that's what causes fracturing after post-placement. So I'm going to go back and protect all my Lumineers so the contact is on natural tooth structure. Open. And so often my high points are ultrabond that I haven't removed. What I like to do is check the occlusion again. Okay. Put your teeth together, put your chin down. And look how nice those teeth look. Grind around a little bit. See how those embrasures open up? And I got just a little here. I'll show you down there. See this little spot right down here on that lower? You got to start looking for that. And I don't shorten the tooth. I take off the labial surface. So, here we go. Open. Chin down. Look at the aesthetics there, and I'm only half finished. When I have them in and I do some more, you got to just make sure that you've got a protected occlusion. Oh, here's another spot right here. I might be able to open a contact for you, which I never do, where we wait 24 hours before we open on porcelain to porcelain. And what I'm doing here is just using my long narrow diamond to follow the embrasure and get rid of any ultrabond that's in there. I'm not applying any pressure. It's just like running a brush up there, because you don't want to have a lot of pressure on when you're finishing, when you're getting porcelain on porcelain. Open wide. Actually, you shouldn't have a lot of pressure anyway if you've opened the embrasures and gotten the ultrabond back. And this is a seri saw. I rock it. don't saw all the way through. If you run into resistance, stop there and start rocking your saw. That's the thing to do. Just rock it like that. You have a lot of, this is the most pressure I use on the patient, and I don't always open all the contacts. This one's a little tight, so I'm not going to press my luck, or your luck. But here, we'll go back to between the cuspid and the bicuspid, because that is two enamel surfaces that we bonded to. So I've showed you how to open a contact, and then we're going to show you how to smooth it a little bit more with the seri sander. But then I run this through the seri sander. It's a safe-sided diamond. Orthodontists use it all the time. See that? Okay. So I'm not going to try to go through these today, because I want that porcelain to get fixed on there, and they'll be very easy to open on her next visit. And I'm going to take just a little bit off of this central right here, and look how you get the definition of teeth. Now look how that changed. Now that looks like a lateral, doesn't it? There's no question about it. All right. Now she only looks half as good as she's going to look when I do the next visit. But she looks great. Now, what do you think of that? You're stunned. Huh? Oh my God. So if you're ever in the area or you want to come out here, just wish you all the luck in the world, giving everybody the smiles they like to have in the way they like to get it. The old paradigm is gone, the new order is in, and you're going to have it. Okay.
When I was 8 years old, my front tooth was broken, and for the next 20 years, my dentist tried to get the crown to match the teeth around it. After 20 years of trying, he finally said, why not get traditional veneers? So I agreed, and they ground down the 3 teeth around the broken tooth, put the traditional veneers on, and the crown. It still didn't match, but it was so much better than what I had. I was happy. I had several friends that had Lumineers, and I couldn't believe the results. When they told me the stories of how easy it was, it just seemed like a no-brainer to me. At first, when I heard that they could be placed over traditional veneers, I was very intrigued, knowing how easy it could be. I thought I was satisfied with my smile till I saw what they could look like. I only wish my dentist had known 15 years ago about Lumineers. I would never have had to go through all the pain and torment. It's the smile I always wanted and never thought I could have. I am absolutely thrilled.